hopefully, if there are few people joining in the last minute, they will only miss my introductions. So welcome to the first Catalyst seminar of the current academic year, which is on why language matters for children and young people's mental health and well-being. And you'll hear from two excellent speakers who I think will tell us about the kind of the social and educational impacts of language impairments and how these can then consequently impact the long-term mental health of children and young people. We know that language and communication are closely linked to emotion regulation and socio-emotional competence, but it's important for us to develop a better understanding of how and why this happens. And then consequently also think about intervention approaches that can help not only the language impairment itself, but also those outcomes that may stem from it, such as mental health problems. We've got two absolutely excellent speakers today. Our first speaker, Dr. Nook, received his PhD from Harvard University and is currently a postdoctoral fellow at Yale University and will begin his assistant professorship at Princeton University in July 2022. He studies how language and emotion interact, how people use words to represent and regulate their emotions, and how these representations may go awry and impact your risk for psychopathology. And he studies these questions using developmental, translational, and neuroscientific tools with the ultimate goal of improving well-being by enhancing language-based tools for detecting and intervening on psychopathology. And his talk today is on how language shapes emotion regulation. Our second speaker is homegrown, Professor Courtney Aubry, who is Professor of Developmental Disorders of Language and Communication at UCL. She's qualified speech and language therapist and did her PhD in experimental psychology at Oxford University. And for the last 10 years, she has been the PI on SCALES, which is this absolutely impressive longitudinal study that tracks language development and disorder of more than 500 children from school entry to secondary school. And her talk today is on developing emotional competence in children with language disorders. I suggest that you will post your questions in the chat, and then there will be a discussion at the end of the talks led by David Skuse, which will then also serve as opening for the questions for both of the speakers, and hopefully a bit of a panel discussion between David and the speakers at the end. So please put the questions in the chat as they come to you, and we will either read them out loud or you can put your hand up at the end, and hopefully we'll get a lot of participation. So Erik, are you happy to start now?
Yes, of course. Sounds great. Thank you so much for that lovely introduction and for the invitation to be here. It's really I think special to be able to share your work internationally. And I was chatting with the other presenters about many connections to UCL. So it's really lovely to be here, even if only virtually. So today I'm going to share with you a line of work on how language shapes emotion regulation, and I'll highlight developmental connections to this work as much as I can. I do have other lines of work that are also relevant that I can sprinkle in the Q&A. I have some slides on them, but I had to make some choices about what to talk about. And so these are the series of studies I'll discuss today. So I want to start with the observation that emotions are a cornerstone of the human experience. Across our entire lives, they guide what we pay attention to, they influence how we act and make decisions, they affect how we relate to others, and they bring color and meaning to our lives. But emotions can also bring us immense pain. Anxiety and sadness can grow so strong that they impair a person's functioning, and this level of dysregulation, which we classify and treat as psychopathology, is extraordinarily common, with 50% of Americans meeting criteria for a psychological disorder at some point in their lives, leading psychopathology to account for a staggering 7% of the global burden of disease. Now, I think that clearly understanding the psychological processes that produce and maintain debilitating emotional experiences is a crucial basic science step for reducing this human and economic burden. But given that the average age of onset for any psychological disorder is 14 years of age, 50% of disorders will onset before age 18, long before adulthood. A developmental lens is really important if we hope to understand how emotions and emotion dysregulation emerge. But where should we start in working against these staggering statistics? Well, since undergrad and throughout my own clinical and research training, I've been interested in the fact that psychotherapy, which reduces difficult emotions and restores psychological functioning, is essentially a set of conversations in which therapists and clients exchange ideas through language. So unlike the surgeon who uses a scalpel, a psychologist's primary therapeutic instrument is our words. So I study how language and emotion interact because I believe it gives us a powerful and ubiquitous entry point to bolstering mental health. And my work advances our understanding of how language and emotion interact by integrating three primary approaches. First, I take a developmental approach, looking at how emotions and emotion regulation develop. I take a neuroscientific approach to look at how the brain represents and regulates emotion. And finally, I'm actually a fully trained clinical psychologist in addition to being a researcher. So I also take a translational approach, asking how we can apply these insights to detect and intervene on psychological problems. Today, I'll discuss an arm of research that's at this intersection of the translational developmental parts of my work. And again, I'm happy to go into more detail of just emotion development if you're interested. So I'd like to start by defining emotion regulation for all of us as the set of strategies that people use to change or modify how they feel. And I'll ask my friend Bob here to help me illustrate one strategy for regulating emotions called cognitive reappraisal. So let's say that Bob has plans to spend next weekend going on a nice fall hike with his friends, but then he learns that it's going to be pouring with rain. And this news makes Bob feel quite sad. So in this situation, Bob has an opportunity to change or regulate his emotions by reinterpreting the situation, to change what it means to him and then how he feels about it. For example, Bob could see this weekend's rainy weather as an excellent opportunity to play a fun new Zoom game with all of his friends without any of them needing to leave the house. And this reinterpretation can help Bob feel a little bit better about the weekend's weather. Now, this strategy of reappraisal has been shown over and over and over again in the literature to be very helpful in making people feel better. And meta-analytic evidence shows that emotion regulation strategies, including cognitive reappraisal, play a key role in mental health. People suffering from mental illness tend to not use as many adaptive strategies like cognitive reappraisal and instead use an excess of maladaptive strategies like worry, rumination, or avoidance. Furthermore, therapy can be understood as this technique, as a set of conversations that move patients from a maladaptive strategy kind of skill set to a more adaptive skill set, training people to replace maladaptive habits with adaptive ones. And so I'm wondering if language might actually facilitate or track emotion regulation in the context of therapy. So I'll tell you a set of studies today I've done on how distancing one's language might do just that. So as I mentioned, substantial data show that healthy emotion regulation is a key part of mental health. And next, I'll give you some more background on why using distanced language might relate to successful emotion regulation. Then we'll dive into some empirical evidence. So as I defined it, there are several strategies people can use to regulate emotions. And one subtype of cognitive reappraisal is called psychological distancing. Psychological distancing involves reinterpreting a situation to see it as more separate or distant from oneself. And I'd bet you've actually encouraged other people to use this technique yourselves, because we often tell people in distress to take a step back, to give it some time, or to give someone some space when they're in a social conflict. And all of these quotes speak to the common sense notion that creating distance, separating yourself from stressful life events, can help reduce the intensity of negative emotions. But even more than that, these quotes actually reveal something deep about how the mind represents psychological distance. So researchers have found that the human mind collapses three different domains of distance, physical, temporal, and social, onto a single dimension of psychological distance. And you can get a sense for what I mean by noticing that, at least for me here in America, I feel closer to Boston than I do to Berlin. But for you all, it's probably the reverse. You feel closer to Berlin than you do to Boston. We also feel closer to our best friends than we do to strangers, like our baristas. And we feel closer to tonight than we do to tomorrow. So this idea that all three of these dimensions are knitted onto a single dimension of psychological distance is the essence of construal level theory, and it's borne out in both behavioral and neural evidence. But not only are these three dimensions inextricably linked in our minds, they're also encoded in our language. So when people use more first-person singular pronouns, like I, me, mine, and my, they're discussing their closest social target, themselves. And when people use fewer of these pronouns, they've distanced away from themselves. Similarly, when you use more present tense verbs, we're discussing the closest temporal target, the present moment, and using fewer of these verbs means we've shifted away from the present moment. So we can measure how close or how distanced any person's current psychological focus is just by analyzing their use of pronouns and verbs. And this is our measure of linguistic distance. So there's the theory if language encodes psychological distance, and distancing your psychological perspective can help you downregulate emotions, then maybe there's this connection here. And likewise, if emotion regulation is important to mental health, then maybe this whole theoretical model should hold. Now we'll move on to looking at some data for these relationships. And the first study asks whether distancing one's language can downregulate negative emotions. So in other words, can you just manipulate your emotions by changing your language? And to test this question, this was in adults. We asked 227 adults to write about negative images for 30 seconds and then report how bad they felt on a 7-point scale. And they did this over and over for a collection of images, but we created matched subsets of images and assigned them to two within persons conditions, such that half of the images people were writing about things as either, and we manipulated distance across these images. Half of them they were writing about very close, half of them they were writing about in a distanced way, but we also targeted the three distancing dimensions that I introduced you to earlier. So one set of participants in the physical distancing condition wrote about half of the images as if they were happening physically close to them when they saw the word here above the image, and they wrote about the other half as if they were happening physically far away when they saw the words not here. A second set of participants distanced along the social dimension by using the word I when writing about one set of images, and then not using the word I when writing about the other set. So we're just shifting their language across the two conditions. And finally, a third set of participants distanced along the temporal dimension. And they either use present tense verbs or not using present tense verbs when writing about the images. And critically, participants in all of the conditions were only given the instruction to change aspects of their language. Emotion regulation was never mentioned. But nonetheless, we found that all three methods of linguistic distancing incidentally reduced negative affect. So having people write about things as happening physically far away from them helps them feel a little bit less negative affect compared to when they write as if the images are taking place physically close to them. Similarly, simply refraining from using the word I reduces negative affect, and the same is true for reducing present tense verbs. So just increasing the distance in your language can downregulate negative emotion. And this is an interesting point. We also found that the dimensions of psychological distance tend to bleed across each other. So participants who are instructed to not use first-person singular pronouns, just don't use the word I, spontaneously used fewer present tense verbs. And likewise, people who were told to distance temporally also reduced their use of first-person singular pronouns. And this is concordant with the idea that shifting along one dimension of psychological distance leads to an internal representation shift in terms of your distance that is then reflected along the other dimensions. And within this paper, we also ran the study a second time and replicated it in an independent sample with different images. So yes, merely using more distanced language reduces negative affect, meaning that language can manipulate emotions. And I'll put up some citations in a moment showing that kids can do this too, which is really interesting. But what about the reverse direction? Might people spontaneously distance their language when they regulate their emotions? If so, linguistic distance could serve also as a measure of emotion regulation. And to test this question, we essentially reverse the previous design And instead of manipulating language and measuring emotion, we're now manipulating emotion regulation and measuring language. So we manipulated whether people responded naturally to negative images on look trials or engage in cognitive reappraisal or change trials by doing what Bob did, right? Reinterpreting the meaning of this image in order to make themselves feel better about it. Maybe a friend is playing a prank on them and putting some plastic cockroaches on their pizza. We counterbalanced images both in this study and the other study to make sure that differences across condition could only be explained by the instructions, not the images. And we also had participants respond naturally to neutral images just as a control. And as we expected and in line with prior work, people report less negative affect when they are reappraising compared to when they're not reappraising their response to negative images. But here in this study, we're really interested in what they're writing in the box below as they're carrying out this task. So we computed a measure of linguistic distance using Linguistic Inquiry and Word Count, or LIWC software from Jamie Pennebaker, which essentially lets us count up their use of first person singular pronouns, present tense verbs, and a few other word classes. Then you can z-score and combine these such that less use of first person singular pronouns and present tense verbs means you have greater linguistic distance. When we analyze people's linguistic data across these conditions, we found that indeed, in line with hypotheses, participants used more distance language when they reappraised. They spontaneously shifted away from themselves in the present moment. They used fewer first-person singular pronouns and present tense verbs when they are trying to reinterpret and make themselves feel better about these negative images. So people spontaneously take a step back when they're regulating their emotions. In addition to this main effect across conditions, we also tested whether the extent to which people can distance their language relates to how successful they are when they regulate their emotions. And we found a significant positive correlation here between how strongly people increase their linguistic distance when reappraising negative images compared to when they respond naturally, and how much they reduce their negative affect between the look negative and reappraise negative conditions. So greater distancing means greater reappraisal, in line with this idea that we can measure how good someone is at reappraising from their language alone. And here's a slightly different way of plotting this correlation. So this red point represents the effect's size, the correlation coefficient of 0.28, and the whiskers are the 95% confidence interval. So it doesn't overlap with 0, which means it's a significant effect. And in this paper, we also replicated the current study in an independent sample using a different set of images, finding a similar effect. And a few years later, Anushka Shahane and Brian Denny came along and replicated the relationship using similar methods. When we line them up, you can see a similarity in effect sizes across studies, which is nice to see. And finally, I got to work with Connie Vidal-Bustamante and Katie Cho on replicating this study in a developmental sample of participants aged 10 to 23. And we pre-registered our analyses and again found this relationship, giving us confidence in the idea that you can measure how good someone is at regulating from how much they're distancing when doing so. But also in this last developmental study, we were really curious if increased ability to distance yourself as you get older might explain increased ability to regulate your emotions. Prior work by Jen Silvers and several others has demonstrated that from childhood into adolescence and young adulthood, there's this increased ability to engage in cognitive reappraisal and use it to change how you feel. So within this study, we tested relations with age, and we were kind of surprised, though, to find no differences in emotion regulation abilities from childhood to young adulthood. So in this task where people are regulating their emotions, whether you're 10 years old or you're 23 years old, we find no relationship with age. You're just as good at down-regulating your negative emotions. And yep, we tried all sorts of nonlinear relationships here, and none of them fit. So I'm just showing you the linear relationship. We go in the paper to some extent in the discussion about why this may have been a null result in this case. And again, I'm happy to answer any questions about that. But it was a surprise to us. And similarly, we found no relationship with this linguistic distancing variable. Children and adolescents distance their language during reappraisal just as much as adults. Now, this was a surprise, which is always a fun scientific emotion to feel, but a reappraisal of that surprise is that this actually gives us evidence that even individuals as old as age 10 can use linguistic distancing to boost their regulatory capacities. And indeed, prior research shows that children can regulate their emotions in frustrating situations by talking in the third person, or as a kind of acute manipulation, talking about what Batman would do in this situation, both of which are cognitive and linguistic tools for creating distance from themselves. So both these data and these other studies, which I think go as young as age 5 and 6 or 6 and 7, show that this ability to use language to regulate yourself are actually online in childhood, and it's kind of an open question about when it comes online. So just to summarize what I've shown so far, we have consistent data that cognitive reappraisal leads to increased linguistic distance, and people who distance more when regulating feel better following reappraisal, revealing bidirectional relationships between language and emotion regulation. So linguistic distance may be a tool both for measuring and manipulating emotion regulation, and this relationship is stable across late childhood into young adulthood. So now the final study I'll show you translates this relationship into the clinical domain, asking whether linguistic distance might track actual symptoms of psychopathology. And existing work suggests that this should be the case. People who experience depression and anxiety tend to use the word I more often. One study even showed that poets who died by suicide actually use the word I more than poets who die by natural causes. Potentially suggesting that getting locked into yourself is reflecting a difficulty finding effective ways to manage your negative emotions. But there's many open questions about how this relationship might emerge in the actual context of therapy and over time in a longitudinal study. So we partnered with an app called Talkspace, which provides a platform for text-based therapy. On Talkspace, clients seeking treatment receive real therapy from a real therapist, but they primarily interact through text message. And initial analyses show that Talkspace reduces symptoms, and because therapeutic interactions are recorded in clients' texts, we can use data from this platform to gain really unprecedented insight into the linguistic mechanisms underlying successful psychotherapy. So clients can text their therapist whenever they want, and therapists respond during set hours each day. Clients complete anxiety and depression inventory measures every 3 work weeks, and we sum them into a measure of internalizing symptoms. We also focus on the first 12 weeks of treatment because symptom reductions plateau after this point. We can then test whether average linguistic distance in each of these 3-week periods is related to the following symptom measure. And we received a ton of data, over 6,000 people with 1.2 million text messages, and we created a holdout subset of participants, a validation subset, and pre-registered all of our analyses and replicated them in this subset after training the models in this subset. And just to show you, symptoms do indeed go down in our data. And again, I'll use this effect size plot to show this to you. So here's the significant negative relationship in the exploratory data set, and we replicated that in the validation data set, which is nice to see. We then used a slightly different measure of linguistic distance in this study, which separately focuses on temporal and social domains. The temporal distance measure is the proportion of verbs that were not in the present tense, and the social distance measure is the proportion of pronouns that are not first person singular. So we see that symptoms are going down, and we also find that linguistic distance is going up, in line with the idea that as you go through treatment, you gain skills in seeing your problems and yourself from a greater distance, and that's really improving over the course of treatment. But are these two things related, symptoms and language? At the between person level, we asked, is a person's average level of linguistic distance related to their average level of psychopathology? And we find that it is. People who are more distanced on the temporal and social domain, these are negative relationships, tend to have less psychopathology. So that's really exciting. In this large data set, we find that you can kind of assess a person's symptom level by looking at their language alone. And we asked a stronger test on the within person's level. Is a person's month-to-month fluctuation in their language tracking a within person fluctuation in their symptom level? And again, we find significant and replicable relationships. But these relationships are very small, something to keep in mind. Nonetheless, this is also advancing our ability to say that you can actually track someone's progress through treatment by looking at their language. The extent to which they have improved their symptoms on a monthly basis is reflected in changes in their language. So yes, we find evidence at both within person and between person levels that linguistic distance tracks actual psychological symptoms. So I've thrown a lot of data at you, and I just want to summarize everything I've shown you before concluding. So findings from this arm of my research show that distancing one's language by decreasing use of words like I and present tense verbs has a bidirectional relationship with emotion regulation. Distancing one's language downregulates emotion, and increasing the distance in one's language does the reverse relationship. This relationship is also stable across ages 10 to 23. And when translating into a clinical context, we found that linguistic distance is a reliable marker of internalizing symptoms in a large data set of psychotherapy transcripts. That said, the linguistic relationships were extremely small. So this should temper our conclusions. We haven't found a silver bullet to psychopathology, but given the sheer number of people suffering from psychopathology each year, finding something that helps people recover a few days earlier could relieve enormous human burden, even if it's a small effect. So with that limitation in mind, I think the take home from my results are summarized in this model below. There's relationships between language, emotion, and mental health. This means that our words are tools for measuring and manipulating emotion and mental health, and given the ubiquity of language in therapeutic and non-therapeutic settings, it's a key target for research and intervention. And I'm really excited in my future line of work. Talkspace has recently opened an adolescent arm. So now they have adolescents and therapists doing all of their therapy over text message. So in the future, I'll have grad student and postdoc opportunities to potentially work with some of those data, translating what I've shown you today down to younger populations. So with that, I'd like to thank my co-authors, research assistants, without whom all of this could not be possible, my funders, and also you for your invitation and attention today. Thank you so much.
Thank you, Erik. That was an absolute masterclass. Really, really brilliant. I'm going to pass over to Courtney now.
Okay, so I think, Erik, that was a brilliant talk, and it set me up nicely because we knew that there was this relationship, and the next conclusion that one might think about from your work is that, well, if the language system is disrupted, then this might create some issues, both in developing these skills, but also in accessing talking therapies. So that's what I'm going to talk to you today about. And I'm going to start by thanking the huge number of people involved in our funders. I've organized them here in terms of people who've worked very closely on the project, Sarah and Laura. Sarah's here and will join in the discussion session. We've had some excellent collaborators, and I will show you work that was informed by our collaborations with Sean Go and Kat Sebastian. And then we've been very lucky to have fantastic undergraduates in PALS here at UCL. So Tatrin and Maria have been contributing to our work, and you'll see how in a few minutes' time. So we're really focused on populations in which language is not developing as we would expect it to be. Our scale study, which I will tell you about in a minute, has established prevalence estimates. And we estimate that about 7% of children in UK mainstream schools have a language disorder that is not associated with another condition, and about another 3% have a language disorder that is associated with another developmental condition, for example, autism or Down syndrome or any of the other things that can disrupt development. Children with language disorders are characterized by the fact that they tend to say less, and what they say is simpler in terms of having much more limited vocabularies and very simple grammar, and that affects your ability to convey relationships between people or events. They very often also will have difficulty understanding what other people say to them, so it's not just in what they produce, but what they understand. And as Erik said, language underpins an awful lot of what we do. So it's not surprising to learn that children who have language disorders are very likely to do not so well at school. They have poor academic attainment. they tend to have poorer social relationships and social interactions. And as they get older, this really affects their ability to get and maintain employment. Language disorder results from a brain that is developing atypically and therefore very likely to see other comorbidities in motor skills, in cognitive ability, in attention. And although if you read the popular press and in fact some research, people like to focus on parental input, but I think it's important to remember that it's a very complex picture. We know from twin studies and family studies and molecular genetic studies that there are strong genetic influences on language, and our environments are shaped, at least in part, by our genes. So what we think of as an environmental effect may also reflect those genetic differences and the relationships between genes and environments. So quite a complex picture. In our longitudinal study, we wanted first to look at the longer term relationships between social, emotional, and behavioral challenge. There have been a couple of population studies that have reported in adolescence that children with DLD are much more likely to experience clinical levels of social, emotional, and behavioral challenge, but these have often not measured those skills earlier in development. So we wanted to take a longitudinal look at that. And we did that in our scales project. So this has been a 10-year longitudinal study. We started it when the children started school in 2011, and we screened just over 7,000 children in reception. And we measured at that point the strengths and difficulties questionnaire, short children's communication checklist questionnaire. And then in the UK, all children have the early years foundation stage profile, which is a measure of early academic attainment. From that sample of 7,000, we had an intensive cohort, which started off with 529 monolingual children. And the sample was enriched for children we felt might have language disorders based on that children's communication checklist. In that first year of school, they had a very comprehensive assessment, and we made research diagnoses of language disorder. I've put the catalyze in there because we informed those criteria, but this is a more inclusive definition of language disorder. So children have very variable nonverbal skills. And then we've seen them at 3 additional time points. We have lots of information from parents and teachers, standardized tests of language and cognition, and many experimental tasks of attention, learning, and social cognition. What I will say, I'm just going to tell you about a few of these results today, but in year 6, we measured children's emotion recognition and emotion regulation skills using a temporal distancing task, which Erik has set up nicely. Our goal was then to measure how this affected mental health outcomes as children made the transition to secondary school. If you check the dates there, you'll see that our study is now completely confounded by a global pandemic. But we were able to see about 239, we saw about 200 of our children before the schools closed, and then a few during the first lockdown. And at this testing point, we had measures of parent and self-report of anxiety and depression. But the rate of attrition there totally reflects school lockdown, I'm afraid. So I'm going to start with our screening sample. What I'm showing you on this graph is raw scores on the early years foundation stage profile. So this is a measure of academic attainment in the first year of school. And what we've plotted here are children who weren't reported to have any difficulties with language or the SDQ, behavior difficulties only, language difficulties only, and then the combination of language and behavior difficulties. And what you can see is that it has a pretty massive impact on your ability to succeed in the classroom if you have language problems, and particularly if those are co-occurring with behavior problems as well. So huge impacts even in the first year of school. We then look to see what the proportion of clinically significant behavioral difficulties were in our 3 groups. So the cutoffs were in quite an affluent area. So only about 5% of typically developing children were reported to have clinically significant levels of behavioral difficulties in the absence of language disorder. Almost twice as many children with DLD who didn't have any other developmental concerns, but this really ramps up when you're looking at language disorder in the presence of another developmental condition. So about half of those children were rated to have clinically significant behavior problems. We then had the great pleasure of having Sean Go come from Singapore to work with us on our longitudinal data. These are looking at different subscales of the SDQ. So we have, I can't see because of the things on my screen, but one of these is conduct, emotion, peer problems, and pro-social behavior. And we've measured behavior at reception and then again in year 3. And what we're looking at here is the relationship with language in year 1 after you account for these earlier levels of difficulty at reception. Hopefully you can see the numbers, but what you see is pretty strong stability of these behavioral difficulties over this 3 to 4 year period. But the other main take-home message is that this relationship is not linear. What you see is that the relationship between language and behavior is much stronger at disorder levels of language. And that relationship is true after you account for other variables such as socioeconomic disadvantage, sex, and nonverbal ability. So this is leading us to think about a threshold account where you actually, having increasingly better language isn't necessarily an advantage, but what you need is good enough language to be able to engage with peers and engage meaningfully in the classroom. So we've just started analysing our year 6 and 8 data with our undergraduate student Maria, and what we find is that these very early language skills are also related to parent-reported mental health symptoms when children get into secondary school. So this is 7 years later. Like Erik noted, these relationships are quite small, but they are significant and point to a potential avenue for intervening earlier in a children's developmental trajectory. So we've provided quite good evidence that those relationships are there early and that they are persistent. And what you often think about as a clinician is, well, if I just improve children's language skills, surely that will have a knock-on effect on mental health. And sadly, we have very little evidence that that is the case, often because in trials, we don't have secondary outcome measures that include mental health. But from what I know about intervention, I think that is a pretty optimistic view. For one thing, it's very hard to change language. That's a whole nother talk. But even if you can make substantial inroads into children's language trajectories, seeing generalization from language to more complex developmental systems is pretty hard to do. So we were interested in maybe more proximal targets that might make for more effective intervention targets. And there's a couple of ways we think about this. So one is that maybe this relationship is not as direct as we think it is. Maybe language is just indexing a whole host of other things that increase risk for mental health. So as I said, language is associated with socioeconomic disadvantage. There's lots of comorbidities. So it might just be flagging other things that are related to mental health. But as Erik said, there's good reason to think there's more direct relationships as well. I'm going to just briefly mention one that we don't have data on yet, but there's been a lot of interest in how poor language affects children's academic outcomes. So I showed you that even in reception, children who have language disorders are not doing as well in school as we would like them to do. And there is this idea that over time that repeated academic failure affects children's self-esteem and that this can then have an effect on mental health. And there's some evidence from a previous epidemiological study in the US that might be the case, because Bruce Tomlin and his colleagues reported that it was only those children with language disorders that went on to have problems with reading and therefore academic difficulties that had clinical levels of behavioral difficulty. But it's also interesting to think about the academic environment. So there's plenty of evidence that children with DLD are excluded by their peers in mainstream classrooms and don't have as well-developed social networks. And we know that they can be protective for mental health as well. And this study comes from the Ottawa sample, another epidemiological study of children with language disorder. And what they found was that children who had early access to special education had attenuated risk of poor mental health as adolescents relative to peers who did not receive special education. It was a small sample, and I'd really love to replicate that, because the interesting thing is those children didn't have better academic outcomes, but they did have better mental health outcomes. And that might tell us something about the social environments and access to other supports that might be useful for protecting mental health. So in Scales, we are now in the process of trying to link our language data for our 7,000 children to the National Pupil Database, which will give us much more information about the educational pathways these children have had and what impacts that is having on their outcomes. But for the purposes of this talk, I'm really going to focus on these two, emotion recognition and emotion regulation, which, as Erik noted, we know these two things are very much related to mental health outcomes, and we wanted to know how children with language disorders engage with these sorts of tasks. So this work has really been driven by my wonderful colleague, Sarah. And in this first study, we looked at emotion recognition from voices and from faces. They were in two separate conditions, but I'm just showing you here for the sake of time. So children saw this fixation cross, then they either saw a face or they heard a vocal sound, not a word, but just a vocal sound. And then they had to choose what emotion that stimuli were representing. And they just had to press a button. We did this when they were in year 6, so that's age 10 to 11. What we found was that children with DLD were less accurate in identifying the emotion from these face and voice cues. And then what we did was to model the longitudinal effects of language. So here we have language in year 1 and this emotion recognition task in year 6. This is faces and voices. You can see that the two are correlated. And you can see that early language affects performance on this task 6 years later. But that's not true for nonverbal IQ. So we wanted to test whether general cognitive abilities affected this, given that the task is quite complex and involves perceptual skills and attention and things like that. So year 1 language is predictive, but year 1 nonverbal ability is not. So that suggests to us that perhaps your early language skills are enabling you to develop these labels that allow you to develop more fine-grained emotional categories, which helps you to learn more about those emotions. I'm now going to switch and talk about a temporal distancing task. This work we did in collaboration with Kat Sebastian. It was a task that she developed when she was with Leah Somerville, who Erik knows, so it's a very small world indeed. Chatrin is now doing his PhD at UCL in the Wellcome Mental Health PhD program, so we're very proud of him, and he worked really hard on this study. So we did a temporal distancing task where we got them to listen. We had to adapt Kat's task for use with kids who had language disorder. So children were just listening to various scenarios, and they were instructed to think about this event happening to them today, but then they were instructed to report how they might feel at different points in time. And they would either be told here, how would you feel now, next week, which is a near future condition, or many years from now, so into the distance. And the scenarios were supposed to be appropriate to adolescents, and they were either negative or neutral. So you fail an important exam today, how will you feel either now, next week, or many years from now? Then they were asked to rate how upset they were feeling. And in Kat's original study, they were asked to rate their anxiety or stress. We didn't do this in this task just to keep it short and something that they could achieve. The first thing to note is about 25% of our children with language disorders could not do the task. So they couldn't engage in future thinking, or sometimes they would say, well, that hasn't happened to me. I don't know how I would feel then. And I think that in itself is an important finding, because as Erik said, these are exactly the kinds of strategies that people will be talking about in therapy sessions. And a lot of children can't engage in that kind of language for hypothetical purposes. And that in itself, I think, is something we'd like to follow up in future research. The children who couldn't complete the task were much more likely to have very severe language difficulties, additional cognitive difficulties, and additional developmental concerns. So that really raises interesting questions about how these children access therapies that are out there already. But for those who could do the task, we do replicate the distancing effect. So what you see here now is the mean distress rating when you have a neutral condition. This is negative now, negative near, and negative distant. So overall, in our population of over 380 children, you do get the distancing effect. When we split it up by group, what we find is a tiny trend for the children with DLD to be less successful at temporal distancing, particularly projecting further into the future, but that wasn't statistically reliable. And when you remove children with additional diagnoses, then it really doesn't look like any effect at all. So providing they could do the task, they seem to be as good at thinking about the future and using that to regulate their emotions as their peers. What's really interesting, Sarah's been doing this very recently and has this coming out in Royal Society Open, is that early language skills were associated with this regulation success, even after we accounted for their current language abilities. So again, their language skills at school entry are having this very long-term effect on their ability to regulate and process emotional information. And this suggests to us that it's not really just the language demands of the task that are driving this relationship, but the role of language in learning how to use these verbal strategies and using language to engage in these self-talk processes. And again, what we find is that regulation success is associated with our mental health outcomes in year 8. So your ability to do this task in year 6 is related to parent ratings on the RCADs once you make the transition into secondary school. So what we've concluded from all of this, what we've found is that language predicts the ability to identify emotions and to use temporal distancing strategies to regulate emotions, at least in an experimental task. The longitudinal relationship suggests that language skills are helping children to develop these skills, probably through interactions with their caregivers and their peers. And that children with more severe language difficulties and cognitive challenges find these tasks really difficult, and that has significant implications for accessing talking therapies. And one future avenue for this research, therefore, is to say, well, with these children, language interventions might be really important for developing target skills that are protective for mental health in general, and may attenuate that risk for poor mental health in children who have significant language disorder. And I think this is a really important point, and language matters an awful lot for mental health research. So we've invested millions in this country in mental health research, which is very welcome and very needed for all the reasons that Erik said. But it's worth remembering who's accessing services. So this first point is from a survey of referrals to CAMS across European countries. And children with neurodevelopmental disorders were the most frequent diagnostic group referred to CAMS, accounting for about 80% of referrals. If you look at children who are identified with emotional and behavioral disorders, about 80% of them have language deficits. And on average, their language scores are about 1.5 standard deviations below the mean. So in that range where children in our study were really having difficulty engaging in the temporal distancing strategies. And really beautiful work from Nancy Cohen and Nancy M. Bolter in Canada has shown over a long period of time that about 1/3 of referrals to CAMS have language disorders that are previously unidentified, and another 1/3 are children with a known history of language disorder. And that these language difficulties really interfere with assessment and also with our intervention. So it's really necessary, I think, for researchers who are developing new interventions to really bear this in mind, because if we don't consider the language demands of the interventions that we're developing, then there's a really strong possibility that the children who need these interventions the most aren't going to be able to benefit from them as much as they could do. And so with that, I'm going to stop and say thank you very much for listening. We have this video on Words for Wellbeing that includes a young person with language disorder talking about why she finds school so difficult and how she had to adapt her relationships with her therapist in CAMS so that she could benefit. If you want to know more about language disorder, there's tons of videos on this channel, YouTube channel. And that's all I'm going to say for now.
Thank you very much, Courtney. And thank you, Erik, for a brilliant talk. So we've had two really astonishingly good and very stimulating and connected talks. So I love the way that they interdigitated. So you know, and I think we've learned a heck of a lot. I certainly have. We have a few questions. I'm going to go through the chat and then maybe open it up for discussion. But because I can't see everybody's hand, because I've got a very limited number of, obviously, of 55 participants or so, and I've only got 6 of you on the screen. It would probably be better if you actually said you wanted to ask a question in the chat. But let's take the first question, which I think came up after Erik's talk, actually, which was, what's the connection between the language issues that you raise, Erik, that are obviously disturbed in people who've got mental health problems and mindfulness?
Yeah, excellent question. And Courtney, wow, loved seeing all of those data put together. I'm positively bursting with ideas, but I will answer the question. So this is a really tricky question. There's kind of a double bind, and I love thinking about it, but I think we just don't have a clear scientific answer. So when you're thinking about mindfulness, yes, it is absolutely the case that the idea is you're helping people develop a habit of orienting themselves to the present moment, right? Which is a very low distance target. But at the same time, you're helping people develop this observing mind, or this sense that they are not their thoughts, and to be able to represent that their thoughts can go through their mind and not, they don't have to engage with it, which is a very high distance perspective. So, and if you double down into the kind of Buddhist origins of a mindfulness practice, you're kind of trying to accomplish a no self, which is an extraordinarily high psychological perspective. So it's this interesting concept where the typical, Yakov Trope psychological distancing framework, where these dimensions are all collinear, actually starts to break down. But I would think of it as still a technique to overall increase distance, even though you're focusing on the present moment. But yeah, figuring that out, I think, is an open puzzle.
Okay, so perhaps the take-home message is perhaps mindfulness does increase distancing, but we're not quite sure how. Oh, okay.
Yeah, exactly.
All right, thank you. the next question I think came up after your talk, Erik, but actually probably fits better with Courtney's presentation, which is to do with an effect before the age of 10. Courtney, do you have a perspective on that?
It depends on what kind of effect they're talking about.
Yeah, I'm afraid it's
yeah.
more explicit. But
So
I guess the effect of the ability to distance, I would imagine they're referring to.
Yeah, so
Yeah.
I have texted Sarah to jog my memory, because I know Chatron, when he was looking at the reliability and the validity of this temporal distancing task, had an adult group, and I can't remember what the age relationships were. Can you, Sarah?
Yeah, so we compared the children in Scales who did the temporal distancing task to a group of undergraduate psychology students. So they were sort of, yeah, we called them older adolescents, but they were 18 to 21. And we found that the older group were more successful than the younger group. So we did see that sort of developmental effect that wasn't there in your work. And I don't have a good explanation for why that might be, but yeah, we did see that.
But we haven't really looked much younger, and Erik might know. I mean, my guess is that children can engage in distancing and regulation strategies, but they might look a little bit different and they might be a little less successful.
Yeah, I think that this, a developmental study really looking, I mean, ideally longitudinally, as you all have, but even just cross-sectionally from very young ages. I missed your age range. What ages?
So for the distancing task, they were 10 to 11.
10 to 11, yeah. So I think looking even earlier is a really exciting open question. I assume that there's at some point you go from not really being able to use language to change your perspective and your feelings, and that is kind of, there's some window where that's coming up, but it's an open question. I'm hesitant to even speculate on it. And I'm not really perturbed to find that you all found a relationship with age. I think that's great. I presume that there are certain contexts in which that happens, and then certain contexts in which it just doesn't. And my hypothesis is it really has to do with how hard the regulatory task is. So maybe my images were just a little bit easier for younger folks or something.
That's interesting, yeah.
Or the writing versus an auditory version of it.
That's another thing, yeah. Well, so I didn't mention this, but in the kids study, we had them speaking out loud, their reappraisals.
All right, okay.
But yeah, that could be another thing.
Okay, thank you both very much for that reply. The next comment is how does this topic apply to deaf communities? Would the language emotion regulation relationship translate to sign language? Or would it be the ability to express yourself through writing that would identify the same sort of issues in those communities?
Well, I mean, it's a great question, and I can't think of any direct evidence, but I can't see why it would be different. I don't think there's a modality specific or any reason to expect a modality specific effect. I think it's how you talk to yourself that's really the important thing. Erik, do you have
I would
any
agree
sort of view?
completely. Jessie Snedeker at Harvard, I know, has a student working with her doing really exciting kind of cognitive building blocks of language in deaf communities and signing communities. I haven't seen their current findings, but I would look there. I agree completely with what Courtney is talking about, and I would also say that I think, connecting to a later question, the environment would play a huge role, right? So if you're in an environment or a family that finds lack of being able to hear an impediment to really connect, and you aren't given tools to form these internal representations and an ability to communicate, then you might find a difference. But it's not really about being able to hear or not. It's about an environmental affordance would be where I would put my money.
Thank you. Okay, I think those are the only questions in the chat, but I wonder if anybody else has got questions that they would like to ask. If not, I've got some.
I think
Erik,
there are a few more things in the chat.
Okay, are there?
Yeah,
Okay,
so Sean goes here. Hello, Sean.
Yeah, okay, I think it's updated itself. I've got one more question. Thanks, Erik. I'm just wondering, one, if you've thought about controlling for individual differences in non-linguistic spatial and temporal representation in your language distancing studies, given that these basic cognitive abilities related to emotion regulation more generally are still developing in children and might potentially confound some of the findings. It's the first part of the very long question.
Yeah, no, that's great. No, what a good, very important idea. In those studies, we did not collect those measures, and it would be helpful to control for them. This, though, I will seize this opportunity to pivot to talk about another set of findings that I have that I think connect really well with what Professor Norbury was talking about. So we ran these studies in, I essentially ran one big developmental study aged 4 to 25, where we looked at how a bunch of different aspects of emotion develop. And one of the tasks we included is this similarities task. So kids are given all of these 10 emotion words, and they just have to slide. It's a very simple task. Just slide a slider to say how similar they are to each other. So you might put happy and excited close together, and angry and scared close together, and et cetera, et cetera. And this kind of circumplex organization is what emerges when you use multidimensional scaling. So you ask an algorithm to say, what are the key dimensions underlying these similarity ratings of how people represent these emotion types? And even though we found this in adults, the kids show this interesting pattern where they seem to really focus on just whether emotions are good or bad, this valence dimension, and this arousal dimension is still developing. And the key mediator of this is vocab. So this is the Wechsler vocab scores over and above their fluid reasoning and control tasks. So I don't have these controls. I would love to have these controls in the linguistic distancing finding, but this is exactly in line with what you're showing here, that the ability to develop language is helping with emotion representation development. So just wanted
beautiful. That's very beautiful.
Thank you very much, Erik. So there are a few more questions in the chat, actually. Thinking about environment, could it be that norms, practices found in mandatory education, I guess mandatory education in the UK, contribute to emotional deficits and poor academic achievement in school children? I mean, that's a pretty harsh question. Courtney, do you want to answer that?
It's probably another whole day of conversation, but certainly one of the papers we wrote about was the mismatch between the demands of the curriculum, particularly in the early years foundation stage, and the language skills that children typically come to school with. So kids start school in the year that they turn 5, which means the youngest children in the class are 4. And if you look at the learning goals for the early years foundation stage profile, they're pretty tough for your average 4-year-old. And there's quite a lot of research about how children who are the youngest in the class, so your youngest relative age, can find that quite challenging. And of course, we have clients, some of exams, and kids often feel like they're under a lot of pressure. I don't think that's particularly good for kids' mental health. Personally, I would orient that first year of school to really focus on developing oral language to improve regulation and social interaction. And I think that would set kids on a very good foundation to go forward. Yeah,
there's a program here that's really gaining ground called Ruler out of Yale Child Study Center. Mark Brackett, I think, is leading that charge. And in the Connecticut school systems now, there are all of these trainings around what are emotion words, how do we manage them, how do we identify them. So I think that's coming, and it's very sorely needed, as I think we all agree.
Thank you, Erik. Well, it may trickle across the Atlantic in 5 or 10 years' time. We sort of realize
more of this. We need more.
We've produced a whole generation of kids who are unable to express themselves emotionally. Okay, so the next question is, using language to create distance appears to reduce negative feeling, says Erik. but children with language disorders may not be able to access this, says Courtney. So they ask, is it better for interventions for mental health for children with language difficulties to double down and spend more time, or avoid, perhaps skip, emotional regulation strategies? Right.
Yeah, it's a good question. I mean, I think it's an empirical question. I think we should really figure, you're asking the right question. Is it the case that we need to, as you're saying, double down and give them the skills, the linguistic kind of conceptual representation skills in order to use the strategies, just as people who don't have these language problems? Or do we need to adapt how we do our treatment and find other strategies? Another paper that just got accepted at Affective Science with Kevin Oxner and Ajay Sapute actually shows that labeling your emotions with specific words makes your regulation worse. This is not what I was expecting at all. And it really has gotten me thinking that in some contexts, using regulatory systems that are just on, I'm not feeling great, how do I make myself feel better, without really identifying your emotions, might be effective in some contexts. So we might need to adapt our therapy rather than expect all individuals to engage with therapy in the same way is one idea.
I agree. And I think there are some interesting things that go on in schools that we don't have a really good evidence base for, but might be really effective. So I'm thinking about zones of regulation where this is just color coded. So I'm in the red zone.
Yeah.
And if you're in the red zone, this is what you need to do to move back into the green zone. And my guess is that kids with language disorders might be able to engage with that a little bit more because it's visual and it's a very clear, do this. But we definitely need some more evidence for how kids with language disorders engage with that.
Concrete. I think the key is making things concrete. And you had that wonderful data point of kids with language delays struggle to imagine the future. And that just is so in line with this, in this task. And I'm not saying they can't do it writ large, but there's an obstacle there. And I think it speaks to the psychological mechanisms underlying this. And so do we need to train them in order to do that? Or do we instead give them skills that are just very concrete in nature? As you're saying, like, where am I on this thermometer? How do I bring myself down again? I love that.
Okay. Thank you, Erik. And it's actually a question specifically for you. What are the implications of your findings on linguistic distancing as a therapeutic tool for underserved communities, disadvantaged communities?
Yeah. What a crucial question. I think that our field is finally being like, maybe it's not the person's fault that they're having all of these troubles. But it's just so baked into so much of how we organize our treatment, how we organize our training, how we do our interventions. And a sophisticated answer to that question is so needed. And I'm really kind of embarrassed to say that I don't have it. I think we need to really work hard to develop it. There's a R01 application coming out that I think would really help with engaging with that. But I can say a few things. One is, I think that this strategy is, writ large, if you can use it, is going to be helpful regardless of your kind of background. But like what we're saying in this conversation with people who struggle to use language, there might be other techniques that are a better help, or maybe finding a way. Who's this at Berkeley? I'm blanking on the researchers. Brett Ford. Brett Ford has all of these interesting studies showing that if you are undergoing a lot of stress, and that stress is something that you can control, it's good to reappraise. But if it's stress you can't control, don't reappraise. Reverse. If you can control it, go out and do something about it. But if you can't control it, then you should reappraise. And so maybe we need to have kind of a top-down approach where people with disadvantaged backgrounds have a different kind of social resource setting rather than helping them, modify their emotions is kind of a radical answer to that.
Thank you very much. And there's a question for Courtney. The start of the talk, but somebody said they might have missed the start of your talk or missed this particular slide. But what particular aspects of language do your data suggest are the most important to target?
That's a great question. In fact, I'm going to just show you the slide that's at the very end of my talk, which I didn't think I would have time to get to, because I think language, as this person's probably alluding to, oh, except my talk doesn't want to go to the next slide. Sorry about that. I think it's all aspects of language. So vocabulary is clearly important, and Erik has shown that, but learning vocabulary in a disconnected way probably isn't the most helpful thing you can do. And as Erik has also alluded to, grammar is important. Your tenses can be quite important, but you know, the kind of syntactic structures you use are important for conveying the causal relationships between people and events, and the relative relationships between people in a scenario. And so that can be really important for understanding who's doing what to whom and why, and how that's affecting your mental health. But then, you know, we put words and sentences together into stories, and that really helps us make sense of the world around us. So we need language to develop our understanding of self and to be able to reflect on our emotional responses to things that have happened to us. And we know from other work that adolescents will return to these stories about themselves when they're in distress. So if you're feeling really horrible now, you can remember a time in the past when you felt happy and you felt loved and you felt supported, and where things were different, and that can help you manage the way that you're feeling at the moment. And I think that for kids with language disorder, it's really hard to develop those personal narratives because you don't have those opportunities, and you don't have those reinforced. And of course, the more you can do that and the better you can understand yourself, the easier it is then to look at what's happening around you and create a narrative around that, and know how your internal states relate to others' internal states.
Yeah.
So I wouldn't want to focus on just one thing. They go together in important ways.
Yeah. Yeah. What you were talking about there made me think of Meg Spear's research, who has really shown at the neurobiological level too, positive memory recollection as a regulatory strategy. But you know, it's also interesting to think about how this aspect of you know, where this whole question of language, emotion, and mental health development is a huge iceberg, and the two, you know, a handful of us are just chipping away at it, but there's so much to discover. And I love you talking about its relation to self-concept, right, and self-concept development. And I wonder if, again, using concrete tools like photographs and picture books and stuff like that can help.
Well, we wrote a grant about that, Erik. We didn't get it, but
oh, that's too bad.
And I think there's really nice tools to do that. I mean, people have their phones now. You can take a picture of an event and talk to kids about it, and they use really nice things. In primary schools here, they have this thing called Tapestry, which is a tool for communicating between home and school, where you can upload photographs, you can upload videos, and I just think that becomes a very concrete thing that then you can then talk to a child about. So a child with language disorder isn't going to be able to come into class and say, we went here at the weekend and it was great because, but if a parent can upload a photograph of that child in that event, then that provides an opportunity for adults to scaffold the things that the child does say and create those memories and narratives.
Yeah,
that's great. Okay, we've got 1 minute to go, and Essie wants to do a little advertising.
Yes, I've also popped something to the chat. So I just wanted to remind, first of all, thank both the speakers and the discussant. I think this has been really wonderful, and certainly judging by the discussant, this has really piqued people's interest and got them fired up. So thank you a huge amount. That's been a great way to start the new term of these seminars. And then I want to advertise the upcoming seminars. There is one each month. The first one is in October, 13th of October, on self-harm in young people and looking at new approaches to intervention. Then 10th of November, we have understanding computational mechanisms underlying maladaptive brain development. We have 3 speakers, and then we have a discussant from an epidemiology point of view, because we try to facilitate the sort of interdisciplinary engagement at UCL. And the final one is an epistemic trust and children and young people's mental health with Peter Fonagy and Sasa Rosenail as speakers. So please note those to your diaries and come to those events as well. And thank you for coming to this one. It was a great way to start the year. So thank you.
Thank you
for the
both.
invitation.
Yeah, thank you all so much. This is
Okay,
wonderful.
there's lots of thanks in the chat. So yeah, everybody's really appreciated it. Okay, thanks very much.
Thank
Thank
you.
you all. Take care. Thanks,
Bye.
Erik. Nice to